I'm Robert Hone, I'm an ENT consultant in East Kent and at the One Ashford Hospital. I specialise in general ENT conditions as well as thyroid and head and neck surgery. I went into medicine because I was I was practical at school and I was very good at the sciences, and medicine gave me the ability to merge the two really. It's sort of a practical application of the sciences themselves, and I always enjoyed science and it was my best subject. So medicine gave me the ability to get a vocational training and a practical job really. And I think that's probably why I've ended up in surgery over medicine or general practice. Well, that sort of happened by accident. I got put in a rotation when I was a junior doctor, and I was based in Medway at the time, and I had two very inspiring registrars who sort of took me under their wing, and they really allowed me to take some responsibility and run my own clinics. And ENT in itself is a very practical specialty. Even as a junior doctor, you're left quite independent, and you get to treat things like nosebleeds, do microsuction of the ears, even at that junior level, to treat patients. And it was the first time I'd really been given any responsibility using practical skills on my own. And I think the trainers who were supervising me sort of inspired me to become an ENT surgeon. So a typical day varies quite a bit depending whether you're in clinic or in theatre, but it generally involves seeing lots of patients. The good thing about ear, nose and throat is you do get a range of patients, those ranging from children up into older patients, and it may involve a clinic where I see up to 12 to 15 patients, taking history, examining them and diagnosing them, and potentially treating them with medicines or listing them for surgery. I do an operating list once a week, usually on a Thursday, when I would come in slightly earlier and list the patients, and then we'd do a day's operating on varying conditions ranging from small to major operations lasting up to 12 hours. I think I like the variation in ENT. You get to see a range of patients, children to adults. There's also a range of emergencies when you're on call, which can be very straightforward, to severe life-threatening emergencies as well. The surgery is also very variable, from microsurgery using microscopes for small ear procedures or on the voice box, to large open surgery involving major cancer operations. And it's also a very multidisciplinary team. Certainly on the head and neck side, we have our team meeting where I work very closely with my maxillofacial colleagues and oncology teams, and there's an excellent team spirit within the department. So at the moment, most of my spare time is managing my two daughters and running our house, which we moved to the area about 18 months ago. We are trying to do up our house, and we've got a few animals which we look after. I'm also a keen sportsman. I have a season ticket to a football team, which I won't talk about on camera in case I upset anybody. And I like to cycle as well. And I'm trying to increase the amount of cycling I'm doing now lockdown is over.